And Darnetta Bascom is here from the Legal Counsel for the Elderly. This is her second visit with us, and in anticipation of open season for Medicare, we thought this would be a good time for her to take you through Medicare Advantage and what it is. And there's so much marketing going on right now, and how not to be taken advantage of with all of that marketing. So without further ado, I'm going to turn it over to you. Thank you for joining us.
Thank you so much for inviting me today. It's a pleasure to be here. Again, my name is Darnetta Bascom, and I'm with the Legal Counsel for the Elderly, and my program is the Senior Medicare Patrol. Now, today we're going to have a virtual presentation about choosing between original Medicare and Medicare Advantage plans. And our agenda for today is who is S&P. We're going to talk a little about the COVID-19 updates, Operation Protect Veterans, what you can do to help prevent healthcare fraud, and report suspected healthcare fraud and COVID-19 fraud and abuse. What are the original Medicare and Medicaid Advantage plans, and know what to consider when you are deciding between original Medicare and a Medicare Advantage plan, and how to act and contact your local state health insurance program, and then the Legal Counsel for the Elderly Services. I know this seems like a lot, but it's really not. It's kind of compact. So next, we're going to go on to our mission. And the mission for Senior Medicare Patrol is to empower and assist Medicare and Medicaid beneficiaries, their families, and caregivers to help them prevent, detect, and report healthcare fraud, errors, and abuse. And we do this through outreach, counseling, and education. Our program is grant funded. We're funded through the federal U.S. Department of Health and Human Services and the U.S. Administration for Community Living. Our work is done in three main areas. We conduct outreach and education, and we engage volunteers. Our program is volunteer-based, and we receive beneficiary complaints. The Senior Medicare Patrol is located in all 50 states, the District of Columbia, Puerto Rico, and the Virgin Islands and Guam. So next, we're going to talk about the COVID-19 fraud and scams. So here we have COVID-19 fraud and scams. And the first here on the list is the COVID-19 testing. Now, this is a scam in that a person will go door to door attempting to perform COVID-19 tests, all the while stealing your DNA and your personal information. Now, another case is where beneficiary reported to the S&P that she was contacted by a man who said he was from Medicare, and the man asked for her to verify her Medicare number, which she did, in order to get a laminated Medicare card, and said he would also send her a face mask and hand sanitizer. Now, I will say that Medicare is not initiating any type of those phone calls, and you should never, be very quick to give out your information over the phone. Medicare doesn't make phone calls. The Social Security Administration, the U.S. Superior Courthouse, Veterans Affairs, they normally send correspondence in the mail. And just to back up a little bit, when talking about this COVID-19 testing, so this person was going around to apartment buildings, and he was also seen in, single family homes, row homes, just knocking on people's doors, asking, saying that he was a consultant from Health and Human Services. He had a form, and he, some people wanted to participate and do this door-to-door COVID-19 testing. So he was able to get some person's, DNA, because he said it was a saliva test, and then also to get their personal information because there was a short form to fill out. So that's how that person was able to steal DNA and personal information from, people who really didn't know whether this was a fraud or not, but we got the tip from the Office of Inspector General that it had been reported that in a certain area in the District of Columbia, there was a person going around committing this type of fraud. So we'd like to bring that to the attention of our listeners today. And then we look at the vaccine access. I don't know if that's really still going on, but people were paying places to get their name on the list to receive the vaccines. So if they weren't age eligible, they were paying places that were administering the vaccine to get on the list. And when we look at this durable medical equipment, such as knee braces and back braces, the fraud in that is where you see these commercials and they're advertising durable medical equipment, such as a wheelchair, a walker, a back brace, a knee brace. And what they do is they attempt to commit a financial exploitation, because if you see this commercial, you call a number, you say, yeah, I would like to get one of these knee brace or back brace. They'll tell you over the phone, because I actually made a call just to verify it. They'll tell you that your insurance will pay for it. That is not true. Your insurance is not going to pay for it. What's going to happen is they're going to attempt to bill Medicare or whatever insurance that you have for this durable medical equipment. It's not going to go through because, number one, you would need a prescription to receive a durable medical equipment. And once it comes through your insurance, whether it's Medicare or Medicaid, and there's no prescription associated, there's no referral from the doctor, then they're going to kick that out, and then they're going to send the bill to you. And they will resort to any means possible to have you be responsible for that bill in the mail. And these durable medical equipments can come up to, up to the thousands sometimes. So, I just want to say that to purchase durable medical equipment, it's not from television commercials. You would first need to be seen by your doctor. You would then receive counseling from him, receive a prescription, and then he will give you references of durable medical equipment companies that will accept your insurance. And that's where you need to shop for those type of things. And then with the home health services, we just really warn anyone receiving home health care services not to sign documents in advance, such as timesheets. We've had instances where a beneficiary signed a home health care service person, their timesheet in advance, but the person didn't come back until the end of the week. And then we look at, them not performing the job or duties as assigned. Those can be frauds or scams when they're taking advantage of the beneficiary by bringing children to work or using the beneficiary's laundry facilities, their telephone, eating their food, those type of things. But if you, ever suspect anything, please contact to report any type of suspected healthcare fraud, contact our office, the Senior Medicare Patrol. We have a hotline, and that number is 202-434-2099. Now, I did a little research on how people are faring as far as, and this was in the beginning of COVID-19, as far as the epidemic was going on, and how people were faring as far as, scams and being isolated. So I researched, and the Federal Trade Commission, they said that people who talk about scams are much less likely to fall victim for them. And what happens if an individual has few to talk to or connect with? More than likely, that person could be at greater risk of falling victim to a fraud or a scam. That's why we like to talk about it and put it out there in the open. So we all know about these scams, we hear about them, and then we share this information with neighbors, with your friends, with, your church members. You just talk about it, you share it, you tell them what you've learned in a presentation today. That helps them not to become a victim to any of these frauds or scams. So next, we're going to go on to our COVID-19 testing and treatment. And from my previous presentations, most of everyone is double vaccinated, double boosted. I just like to put this out there just in case, people are still searching for places to get their vaccine and boosters. The Medicare is covering the COVID-19 vaccinations and boosters and treatments. And as far as the Medicare Advantage plans, they may waive cost sharing for COVID-19 testing and treatment per Center for Medicare and Medicaid guidelines, CMS. And if you're still looking for a place to get a vaccine or booster, We have a vaccination hotline, COVID-19 vaccination hotline, and that number is 1-800-232-0233. Again, the COVID-19 vaccination hotline is 1-800-232-0233. Okay. So next is our Operation Protect Veterans. So, American veterans are warriors trained to handle anything on the battlefield, but there are one too many veterans struggle to defeat, and that's domestic fraud. Did you know that veterans are twice as likely to fall victim to fraudulent schemes? ARP did a study and found that 16% of veterans have lost money to scammers compared to only 8% of non-military public. So just want to expound on a few of these scams here, and really they could be applicable to anyone. So the VA scam, this is where fraudsters will often contact a veteran by phone or email claiming they are officials from the Department of Veterans Affairs. Now, I just recently said that Veterans Affairs, Social Security, government agencies, they very rarely make a phone call out. So please don't look, to expect phone calls from the VA, because you'll get a correspondence in the mail. But, the critical thing in this is to remember that not to automatically accept the caller as who they are portrayed to be. When coming in contact with a potential scam like this, you should ask for their name and title and confirm that information independently from their phone call. You can call the VA and ask, do you have any counselors or consultants working with you, contacting beneficiaries? So that's one way to help take care of that scam. But in the event that you're not comfortable calling the VA, you can always call our office. We have a list of potential scams, as I said, reported to us from the Office of Inspector General. Now, we also have the tech support scam, and these are suspicious links and high pressure requests. So criminals realize you're more likely to click on a dubious link if you feel that you're under pressure. So be very wary of emails containing suspicious links or attachments that create a sense of urgency. And we're getting close to our tax season again. So just to be on alert, the IRS tax scam, it never goes away, never goes away. This is just a relentless scam. And they try to manipulate it each year. But this past year, taxpayers were receiving emails that appear that they're from the Taxpayer Advocacy Panel, and it's about a tax refund. So I think people will be really, anxious and excited to click on a link that says, hey, this is about a tax refund. But please be careful. These emails are phishing scams trying to trick victims into providing personal and financial information. So don't respond to links or high pressure requests. Always take time, take a moment to breathe and see if you can research that information that's given to you separate from your phone call. You should be able to do that. So just be very alert. If you have to report any suspected fraud, give our office a call at 202-434-2099. So now we're going to review what you can do to help prevent healthcare fraud. So what you can do to help prevent healthcare fraud is you could prevent it by treating your Medicare number as you would your credit card. Keep it private, keep it secure, only give it to your doctors, never give it to persons over the telephone. You don't give out your Medicare number in community settings. I have participated in a number of community health and resource fairs. And I noticed where, they may have a mobile unit set up where they're giving out or administering free glaucoma tests. In that setting, that person should never ask you for your Medicare number. They should not ask you for your important personal information, social security number, date of birth. If at best, they may ask for your name to put your name on a list to show how many persons they served that day. But in that setting, You should not share your Medicare number, Social Security number, date of birth. You don't have to put down your address, your age, any of that important information. So steer clear from that. In healthcare, community health and resource fairs, any place that is not your healthcare provider, I would steer clear from giving out your Medicare number. And then when we look at detecting it, you can detect healthcare fraud by reading your Medicare summary notice to spot potential errors. Now that you will receive on a quarterly basis, your Medicare summary notice if you've gone to the doctor during that time. And it's a good, piece of information to review. Make sure it's your information. You want to look at the name, make sure it's spelled correctly. If you have a middle initial, make sure that's they're included in your name, the address is correct. And then, Medicare sends notes and messages through the Medicare summary notice. So you want to look for any notes or messages. You want to look at the doctors that you visited within that quarterly period. Any services that were rendered, make sure that they're all there and listed correctly. And then you want to report. This is how you help prevent healthcare fraud. Report it. If you see any potential errors on your Medicare summary notice, if you've accidentally giving out your personal information, your Medicare number, your Social Security number, anything like that, you want to report it. You want to report healthcare fraud by contacting your local senior Medicare patrol. And for the DC, again, it's DC Senior Medicare Patrol. Our hotline number is 202-434-2099. Okay. And again, here's to report suspected healthcare fraud and COVID-19 fraud and abuse. You contact your local senior Medicare patrol, 202-434-2099. And our national number is 1-877-808-2468. As I said, we are a national program. Now we're going to get down to why we're all here, and that's to understand original Medicare and Medicare Advantage. So what are original Medicare and Medicare Advantage? So the original Medicare is the traditional program that's offered directly through the federal government. And then the Medicare Advantage plan is a private plans that contract with the federal government to provide Medicare benefits. Now, people with Medicare can choose to get their health coverage through either original Medicare, and that includes your Part A inpatient and hospital coverage, and also covers your Part B, which gives you your outpatient and medical coverage. So, you'll receive a red, white, and blue card to show your providers when you're receiving care. You also, most doctors in the country take your insurance, your original Medicare. And Medicare limits how much you can be charged if you visit participating or non-participating providers. Okay. Now, when you look at the Medicare Advantage plans, they have to give you your Part A and the Part B of your original Medicare. But they also come with a lot of other caveats, like they may offer you dental, they may offer you vision coverage, they may offer transportation. They may offer you a booklet where you can receive a benefits card to order supplies, healthcare supplies from the booklet. But you have to realize that the Medicare Advantage plans, they are private plans. They are contracted with the federal government, and that means they can set their own prices. The prices for the Medicare Advantage plans are a lot different from original Medicare. And it's something that you definitely will want to, view your options as far as finances are concerned. Now, some of the most common types of plans are the HMOs, Health Maintenance Organization, HMOs, Preferred Provider Organizations are the PPOs, and then the private fee-for-service are the PFFS. So if you join a Medicare Advantage plan, you will not use the red, white, and blue card. When you go to the doctor or to the hospital, instead you will use the membership card your plan sends to you to get health services covered. So the plans must provide the same benefits offered by the original Medicare, but they also have applied different rules. And as I said, the cost is different and there may be some restrictions. They also may offer certain benefits that Medicare does not cover, which is a plus. But you have to make sure that you can afford these Medicare Advantage plans. Now, if you sign up for original Medicare and then later decide you would like to try Medicare Advantage plan or vice versa, be aware that there are certain enrollment periods when you are allowed to make changes. Now, we're going to go over what to consider when you're deciding between original Medicare and a Medicare Advantage plan. Oh, I didn't give my reference. So if you have your Medicare and You handbook, if you look at pages 57 and 61 in the 2022 Medicare and You handbook, it gives you all more in-depth information about original Medicare and the Medicare Advantage plans. Okay, so here we're going to know what to consider when you are deciding between original Medicare and a Medicare Advantage plan. So it is very important to understand your Medicare coverage choices and to pick your coverage carefully. Some of the important factors to consider when you're deciding between original Medicare and Medicare Advantage plans are cost, supplemental insurance, provider access, drug coverage, additional supplemental benefits, and out-of-pocket expense. So for cost, this is what premiums and out-of-pocket costs will you be responsible for? That's the cost. And when you look at supplemental insurance, this is, asking, will you be able to purchase an affordable Medigap policy to go with your original Medicare? If you have retiree coverage, how will it work with your Medicare coverage that you choose? And then when you look at provider access, that's what kind of providers can you see? Do you have to stay in network or can you go out of network? Do you need to use like the network of providers to get referrals, to see a specialist? Are the providers that you can see, are they very convenient and easily, conveniently located to you? Can you get there easy? You also want to look at the drug coverage. Sometimes the Medicare Advantage plans don't cover the same drugs that your Medicare Part D plan will cover. So you have to ask that question. You want to have a list of all of your medications that you're currently taking when you decide to switch from your original Medicare to a Medicare Advantage plan or vice versa. You want to know, is the prescription drug coverage included in the Medicare Advantage plan, or do you have to purchase that separately? Now, if you have a Medicare, if you have original Medicare, you would have to purchase your Medicare Part D plan separately from your original Medicare, which is your Part A and your Part B. If you have Medicare Advantage plan, they may come included. It may come included in the your Medicare Advantage plan, but if not, you want to make sure and find out if you need to purchase that separately. And then once you start to look in the prescription drug coverage, you want to make sure that your drugs that you're currently taking are on that list and you're able to get that plan. And also you want to learn about additional supplemental benefits, are additional services like vision, hearing, or dental coverage. Is that included? You want to ask, what is the out-of-pocket limit? Is there any annual limit on out-of-pocket costs for medical services? You want to ask, can you purchase supplemental coverage that will limit the amount that you spend out of pocket? So, we're going to get over to who to contact and get all of this information, get all of your questions answered when you're thinking of, your original Medicare and your Medicare Advantage plan. We have a place that's called the State Health Insurance Counseling Project. And here on our next slide is how to contact your state health insurance program. This is your one-stop shop for all of your services when it comes to getting the counseling that you need as far as your health care is concerned. Now, you contact your state health insurance assistant program for help evaluating your Medicare coverage options and learn about what Medicare Advantage plans, Part D prescription drug plans, and Medigap supplemental insurance plans are available in your area, which is DC. And that number is for the state health insurance a counseling project is 202-727-8370. And for Maryland, the number is 1-800-243-3425. Now, if you would like to change your coverage, you can also call Medicare. And that number is 1-800-Medicare, and it's 1-800-633-4227 to make changes. You can also contact the DC Senior Medicare Patrol if you believe that you have experienced Medicare fraud, abuse, or errors, or if you experience suspicious plan marketing. And since I mentioned plan marketing, when we're getting closer to our Medicare open enrollment, so you may start to see these commercials, and they are just what they're supposed to be, commercials. They're advertising for Medicare Advantage plans, and you may see some celebrities there working. They're working. You may see JJ Walker, or you may see Patti LaBelle. They're working and they're advertising a certain Medicare Advantage plan. That doesn't mean that it's for you. That is not where we suggest anyone look for any type of health coverage using a commercial advertisement. Please don't. You want to call the DC State Health Insurance Counseling Project. Again, the number is 202-727-8370. And for Maryland, it's 1-800-243-3425. And I always give the Maryland number because you may know someone that lives in Maryland that may need this phone number, and at least you'll have it handy. And then you can always give our office a call. And our number again is 202-434-2099. But pretty much steer away from people. You have Medicare Advantage plan representatives. And as we get closer, I'll have another presentation talking about plan marketing, the do's and the don'ts. That's a whole separate presentation because Medicare Advantage plan representatives, they have certain guidelines that they have to adhere to according to the Center for Medicare and Medicaid Services on how they approach and speak to our Medicare beneficiaries, or how they advertise their health, their Medicare Advantage plans. They have certain marketing guidelines that they have to adhere to, established by Center for Medicare and Medicaid Services. So, and that's also included into another presentation, but I'm just putting it out there because it's going to ramp up really quickly. Just try to, not focus on those commercials, people approaching you in the street. You may have people that want to put their business card in your mailbox. They may put flyers on your cars. All those things that they're doing are not permissible. They're not going according to the plan marketing guidelines. They're not supposed to approach you in the street. They're not supposed to cold call you. They're not supposed to put flyers on your car. And they're supposed to explain the plan in all of its detail. How much it's going to cost you, how are your prescription drugs covered, are there any other out-of-pocket expenses you may have to, be aware of. But sometimes when you have these, some can be fast-talking Medicare Advantage plan representatives, and they don't give you all of the details for you to make a good informed decision about your healthcare coverage. And then you're in a pickle. But the good thing is, if you happen to get in a pickle and you don't like this Medicare Advantage plan, it's not suitable for you, you can call the State Health Insurance Counseling Project and tell them that you want to go back to your original Medicare. And if you don't get in touch with them, you can call the Senior Medicare Patrol and we can help you go back to your original Medicare. Okay, you can always get help. So next, we're going to talk about the Legal Counsel for the Elderly Services. And as I stated before, I am with Legal Counsel for the Elderly, and along with housing, my specific program, Senior Medicare Patrol, Legal Counsel for the Elderly provides free legal and social work services to DC elders 60 years of age and older. All are welcome to contact the legal hotline. And the legal hotline provides free legal advice, assistance, and referrals for civil issues that a senior may confront. Now, the legal hotline number for Senior Legal Counsel for the Elderly is 202-434-2120. Now, we also have the Consumer Advocacy and Home Preservation Practice. Now, this area aids seniors facing consumer scams and financial exploitation, but mostly provide representation, helping elders to avoid foreclosure so they may live securely and comfortably in their homes. And next, we have the Economic and Healthcare Security Practice. Now, this area helps seniors receive the income, benefits, and services to which they are entitled to help them live independently. Now, I'm going to just focus on this one, this economic and healthcare security practice. They really do a lot of work with helping our veterans. If you know veterans that, they're not sure if VA owes them additional money, or if they just want to find out, we have a veteran advocacy project. And this project has helped so many senior veterans. They have found out that they actually VA owed them additional money. And just speak about one of my own volunteers is a veteran, and he contacted LCE to find out if VA owed him additional money, and they did. He now receives an additional $800 a month from VA. So it's definitely worth it. Or if you want to know if you are eligible for any of the social service benefits in the District of Columbia, we have a benefits checkup, and they can tell you if you're eligible for the SNAP program, or if you're eligible for Medicaid program. So it's a good, this area right here does a lot of work as far as the social service benefits, looking for additional income for our seniors in the district, and that's the Economic and Healthcare Security Practice area. And here we have the Tenant Advocacy and Support Group. Now, this area combines legal and social work and volunteer coordination to help prevent the eviction of district elders. Now, they also help tenants access repairs, request disability-based accommodation, and assist in fighting illegal rent increases, and coordinate other necessary community services to remain housed. We do get a lot of donations from organizations. We get furniture donations. We have a team that will help, just for example, if a senior lives in an apartment building and they're suffering from housekeeping issues, and the manager says, well, I really want this person out of the building. There's a lot of complaints. Before any of that happens, we have built a wonderful relationship with a lot of the senior housing and apartment builders in the district. They'll call us and say, can you put a team together? We have a senior that's suffering from hoarding issues. And I've actually volunteered with the program myself. And we'll go in there with clear egress. We have furniture that we can donate. I've even helped paint a person's house once. But this is, the pro bono access to justice is wonderful. So if you do need any of these services, you give the Legal Counsel for the Elderly a call, and the number is 202-434-2120. We help with life planning documents, the wills, power of attorneys. We help with fighting illegal rent increases. We help with access and repairs, request disability-based accommodations. We also help with financial exploitation. I'm just going over a little recap of everything that we help with. Now, we also have the Office of the DC Long-Term Care Ombudsman Office. Now, this is also a part of the Legal Counsel for the Elderly. Now, the Office of the DC Long-Term Care Ombudsman, they advocate for residents in long-term care facilities, respond to care complaints, and they educate the community. Now, the Ombudsman group, they advocate for residents of nursing homes, assisted living facilities, and community resident facilities. They also help with provide residents in their private homes who are receiving home health aides through the DC Medicaid waiver program. And this helps to resolve complaints about individuals or group of individuals. They also, they have been on the front line advocating for legislative changes to improve residents' quality of care and quality of life. Now, during the early onset of COVID, the nursing homes were hit really hard, and the assisted living facilities, and they were just greatly impacted. But just to let you know, the DC Office of Long-Term Care Ombudsman, they were on the front line. They were responding to questions and providing information. They had collected all the data from the DC Health Department's website on the number of COVID cases, and they're still doing that today. And they were reporting the number of COVID cases and deaths in each facility and posting them on the LCE website weekly. If you ever want to look at the LC website, that is www.aarp.org/LCE. Again, it's www.aarp.org/LCE. That's where you can see more information about the coronavirus, videos of staff providing legal and general services. Now, this does conclude the ending of my presentation, and I am going to stop sharing to open up for any questions. Thank you.
Does anyone have any questions?
It's a lot.
Oh, here we've got one in the chat. Can you give some very general examples of the type of situation where Medicare might be,
Oh, okay.
Medicare Advantage might be a better option than original Medicare?
What I can do is I can give you some general examples of that could help you make a good choice, or not really make you a good choice, but just I can give you examples of some questions that you can ask the state health insurance assistance program that could help you make a better informed decision. Because I don't know all of the nuances as far as all of the Medicare Advantage plans, because they're private. But what I will say is, with your original Medicare and a Medicare Advantage plans, for your original Medicare, you have your Part A and your Part B. And let me get my booklet out here so I can tell you, give you more specific of what this is, what it covers. So when you look at your Medicare, your Part A and your Part B, okay, here we go. So your Part B, that helps cover your medically necessary doctor services, outpatient care, home health services, durable medical equipment, and mental health services. That's what your Part B will cover. And then when you look at your Part A, this covers home health care services. It covers your blood work at no charge. It covers hospice services. It also covers the home health care services, hospice services, inpatient care. So those two, your Part A and your Part B, when you choose to get a Medicare Advantage plan, they have to give you everything listed under your Medicare Part A and your Medicare Part B. And they also have to give you services that Medicare will cover. So if Medicare says we're going to cover pneumonia vaccines, we're going to cover COVID-19 vaccines and treatment, we're going to cover the monkeypox vaccine, then that means the Medicare Advantage plans, they have to cover those same services. You definitely want to look at the cost associated. It's a very different cost from your original Medicare premium. I think it's about $143, if I'm not mistaken. Medicare Advantage, your original Medicare premium, I think it's about $143, opposed to Medicare Advantage plans. They can go up to $500 or $600. You have to, make sure that, it's cost effective for you. And then you want to make sure the location, where is the place you have to go to get your service when you're looking at Medicare Advantage plans. You want to find out, if you have any health conditions that require a specialist. You want to find out if the specialty doctor is included in the Medicare Advantage plan premium costs, or is that billed separately? You want to find out your out-of-pocket expense as far as co-pays are concerned. You also, I think I said about the prescription drugs, you want to make sure you have a list of your prescriptions that you're currently taking. When you're talking to the SHIP, State Health Insurance Assistance Program, you want to talk to them about all of the prescriptions that you're currently taking to ensure that the Medicare Advantage plan, either they have their own prescription drug plan included, or do you have to purchase it separate, like a Medicare Part D plan? Let's look at, if you have your Medicare and You handbook, if you look at page, if you look at page 68, let's start on 64. Let's see, Medicare Advantage plan out there. Now let's start here. Look at, if you have your Medicare Advantage, your Medicare and You handbook, 2022 Medicare and You handbook, if you look at start at page 61, it says section 4. It talks about Medicare Advantage plans and other options. I love this. This is how I really learned a lot reading these. I don't know if you can't see it because of my backdrop, but I use the Medicare and You handbook a lot. It's like my Bible. So anything that you think you want to know the answer to, without, being on hold with Medicare or another agency, you can use that Medicare and You handbook, and it tells you everything that you need to know. But that's I don't have enough information to list out all the Medicare Advantage plans and all of their services and costs, but the best place for you to go to get that information, and really the only place to go, is the State Health Insurance Assistance Program. And if you have your book, your Medicare and You handbook, on the back, it gives you the phone numbers. So for DC, the State Health Insurance Assistance Program, the number is 202-727-8370. And you call them and they will counsel you and sit with you and go over all of the prices, all of the services if you're looking for, and you can actually tell them what you're looking for. If you want a healthcare plan that includes dental, vision, transportation, they can find that type of program, healthcare program for you. And they'll give you the comparison of cost to your original Medicare. Or if you have original Medicare and you want to go to the Medicare Advantage, or vice versa, that's where I would start.
Another question. Can SHIP also help figure out the best Medicare Part D program?
Yes.
Yeah.
Yes. Yes. And you tell them that, if you have your original Medicare, it doesn't come with prescription drugs. So then you'll be looking for a Medicare Part D plan. And I would have the list of medications out there in front so that you can talk with the counselor about that. You want to make sure when you pick your plan, your Part D plan, that your prescriptions will be covered.
No other questions. Yeah, very good question.
Yeah,
they've come in and talked to us in the past, and really great organization. Well, if no one has any other questions, I'd like to thank you, and also alert people that Marianne Griffin's going to be doing another Medicare presentation for us coming up in the next month or two before open season. And stay tuned, keep an eye out on our newsletter for exact date and time. So this has been wonderful.
Thank you.
Thank you. Thank you.
Thank you. Thank you for having me today. I always look forward to it, and I look forward to presenting again in the future. Thank you so much.
We hope you will.
I will, definitely. And you stay safe out there. We know that COVID is still going on.
Oh, Alice has her hand up.
Please.
Wait just a moment. Do you have a question, Alice?
Oh, Is she
You're
frozen?
on mute, Alice, if you had a question.
I think she's frozen.
I'm
Oh, there she is.
I'm from Bethesda, and I'm trying to find out if we can get such a great program for our village. And I thank you for letting me join yours.
Oh,
Yeah, just if you have the office, reach out to me. I can forward contact information.
Okay, great. Thank you.
Or you can just invite everyone from Bethesda to come join us. Either way.
that would be wonderful.
Well, we all the villages share in programming because,
Oh, okay.
and even if we repeat programming, it's great because, you know, it might not fit in someone's schedule today and another time might be better. So
Different options. That's good.
different options.
Yeah.
All right. Thank you very much.
Thank you
Thank
again.
you.
Thank you. And you all have a wonderful day and stay safe.
You too.
Okay. Bye-bye.
Bye-bye.